So before we jump into different types of hand fractures, it is important to know just a brief anatomy of the hand and whatever other body part you're studying. You don't have to get too into it. The NBCOT is not going to ask specific anatomy questions, but it is good to have an understanding of what's going on in your body when fractures occur. So I would pause this, review it, look it over. I tried finding two pictures that were very self-explanatory. On the left, we have the hand. Just remember, phalanges are your fingers, metacarpals are around your palm, and carpals are your wrist. And then on the right here, it's just showing the radius and the ulnar. I always remember radius is the thumb side. So no matter if your hand is supinated or palmated, it's always going to be on which side the thumb is. When you think of a hand fracture, you want to think of these three main types of fractures. You have your proximal, your carpal, and your avulsion. So a proximal fracture is a metacarpal fracture. It's also known as a Bocker's fracture. It's toward the fourth and fifth finger, as you can see in this picture right here. Next one is carpal fracture. These are fractures to individual carpal bones. Remember, carpal is in your wrist. The most common fracture that's seen and can be missed in certain injuries is the scaphoid, and that's in your wrist as well. The last one is avulsion, and we'll go into the three types on the next slide, but an avulsion is when the tendon separates from the bone, and when it separates, it removes part of that bone material with it. So when an avulsion occurs, it'll be seen in these three different ways. So there's a mallet finger, a boutonniere deformity, and a swan neck deformity. I put, what's affected down below, the DIP, the PIP, what's in hyperextension. I personally would recommend going on Google and looking up different pictures of each one. I think you have a better understanding versus just reading, okay, my PIPs and hyperextension, or I think visually it helped me study better. You can do different tricks to help you study. From mallet finger, if you Google an image of a mallet, it looks similar to the finger. If you Google what a swan neck looks like, if it's looking down eating, it kind of looks like the finger. Whatever helps you to memorize these avulsions, go for it. But I just thought I'd put some clip art pictures for you guys to study. As these hand fractures heal, they're going to go through three common phases, which are inflammation, repair, and remodeling. So when you think of interventions, there are a ton that you can do. One of them is splinting, so I put just three options up here. The first one is a DIP extension splint. What would that be used for? Right underneath, mallet finger. Remember, mallet finger is when the DIP is in flexion. So that splint is going to want to correct it. So the opposite of flexion is extension. That's how I remember the splint names. This other one for boutonniere deformity is the PIP extension splint. And then the proximal fracture, this you're going to use a metacarpal splint. It's also known as boxer finger as well. It includes that fourth and fifth finger fracture. And just a few more interventions. I have a flame here because modalities that include heat for pain relief and tissue healing will help, like this paraffin wax, or cryotherapy, ultrasound, or there's something called TENS. It's basically an electrical nerve simulation. And then this other one here are specific either home programs you can send your client home with, or therapeutic exercises to get that active range of motion going. Controlled active range of motion is not going to begin until 3 to 6 weeks after the fracture to want to make sure it's stable. So that was a general and quick overview of hand fractures, the interventions, the types, a little anatomy review. So I hope this helps, and I'll see you guys in my next video. Bye. We should be closer than friends.